go ahead and transition. Oh, there you go. That's the wrong button, Dr. Seabrook. But anyway, I want to go say good morning to Dr. Jan Seabrook. How you doing?
I'm doing very well, Jeff. How are you?
I'm great. It's good to get you in studio this time. We talked last time on the phone, but always good to have you. Once again, I want to just tell you personally that I really appreciate the work that Community Health Net and you all have done in the community. I mean, I see you moving. I see the little buses and the expanding the dental programs. And as you and I were talking about the last time you were a guest, you're going out here making sure people get access to the health care. Sometimes even working out the logistics of payment and all that a little later. And I think that says a lot about the character of your organization and the mission of you and your team.
Well, thank you so much for saying that. And we're really having almost like a renaissance as far as the dental field is concerned. We have two great dentists, Dr. Trevino and Dr. Black. Dr. Jared Black and Dr. Hector Trevino are two dentists, and they have just been doing amazing things to patients in the community. People who had gone without dental care for a number of years, even before the pandemic. So we're helping to restore people's smiles. It really feels good. The patients are so happy and so ecstatic. They come in and they're not smiling. And then even with the temporary dentures or partials, they're smiling while they're waiting for their dentures to be completed. And we're a full service dental organization. Many of the things that you can't get at other FQHCs because they don't want to pay for it. And we know that people in our community...
Well, explain what FQATs are for people that don't know.
So federally qualified health centers receive some funding from the federal government to take care of the uninsured, but that does not preclude us from taking care of people with commercial insurance,
Absolutely.
Medicaid, and Medicare.
Yes.
And so when we are able to collect from commercial insurance, Medicaid, and Medicare, it allows us the ability to be able to take care of people who don't have health insurance.
Right.
And it allows us to be able to slide their bill based on their income. So they may not pay 100% of what it actually costs, and we're able to help defray some of that cost. But this is for someone who's totally uninsured.
Absolutely.
If you have health insurance and there's a portion that you do have to pay, we can work with you to help make those payments more affordable.
Like if you've got a deductible issue and things of that nature.
Exactly.
Well, let me ask you this. You and I I've never really gotten an opportunity to ask you this because I've got some friends. You know who my guys are, who are physicians, and we were just talking a couple of weeks ago at our fantasy football draft. But I like to pick their brains, and we were just talking about medicine, and I want to ask you this because I think it's kind of impressive as you talked about the two dentists that you bring on board. I want to ask you from a professional standpoint, like what are you selling? How do you sell this to other physicians? Because right now, just the way it seems like the industry is getting very fluid. There's some there seems to be a certain part of the industry that looks like it's going to be more governmental, and then obviously you have people that want to kind of keep it wide open and more kind of capitalistic. I'm kind of simplifying it, but when it seems like it would be very difficult to retain people and get them under the umbrella. But you've been able to do that at Community Health Net. And like I said, it's not like you're expanding the cost. It's not like this is some kind of boutique, high operating boutique practice. I mean, you're out here serving people in the community. This isn't kind of like a Beverly Hills type practice. I mean, you're doing very well. I'm just saying, but somehow you seem to be able to lure the talent in and get them to buy in. That's kind of what I'm asking.
So our providers are dedicated to the community and to the population that they're serving. And Dr. Trevino and Dr. Black are two of our youngest providers to the organization. But many of our providers have been with Community Health Net over 10 years.
Okay.
And they're dedicated to their patients and to the population that we're serving. It's just pure, straight up dedication.
I like that.
And wanting to serve the community. And once you get involved at a fairly qualified health center, particularly Community Health Center, you get so tied into the culture.
See, that's where I'm going with it. Yes.
And you get so tied into that culture of wanting to make sure that your patients' needs are met. And I understand about boutique and kind of
some of these people are associated.
Right, but have you ever walked into a physician's office where you're going to have somebody looking at your social needs? Do you need transportation? are you having difficulty with food insecurity?
Yeah.
So we have food boxes, and we're able to assess and make sure that people have food.
Right.
When they leave from the office, if there's that need. So we try to look at all of the things that may prevent someone from being able to be totally dedicated 100% to taking care of their health. If there's some other things that are blocking you from being able to focus and concentrate on your health, maybe it's, I can't afford those prescriptions when Dr. X writes them, but guess what? You can afford them because we have the ability to utilize programs that discount medications, but only if you're at a federally qualified health center. And I do have some good news.
Right.
We're in the process of opening up 2 pharmacies, one in our Martin Luther King location.
Yeah, right here.
And, yes,
okay.
Right across the street from you, and then our 1021 West Fifth Avenue location.
Yeah.
So next year we're going to have pharmacies in those 2 locations. What that means is, once you see the physician or the dentist, you'll be able to walk out.
It's amazing.
And get your pharmaceuticals, get your medications if you need them. If you are at one of our other locations, you can come to Fifth Avenue or to Martin Luther King and pick up your prescriptions when we have those pharmacies open. We're also looking into mailing from medications from our pharmacy locations to your home.
Wow.
For patients that are unable to come and pick them up. So next year is going to be very exciting for Community Health Net. And we just, even through the pandemic, we've opened up new services. We started our dental program during the pandemic.
I remember.
Our optometry program was 1 year before.
Now, see, that's what blew my mind when you started doing optometry. I'm like, come on, Janet, what are you going to do? Monopolize the market? But go ahead, please.
So we started our optometry in 2019, right before the pandemic. It started,
it's going to be one-stop shopping with you, isn't it?
Basically, that's what we want to do. We integrated behavioral health
goodness.
in 2015.
Yeah.
So we have a clinical psychologist, licensed clinical social workers, mental health counselors. And so what we try to do is meet our patients where they are.
Right.
And meet those needs where they are. Started chiropractic.
Oh my God, Janet, come on.
So we're just trying to help our patients because, there are patients that do have addictions.
Yes.
And we're not in the, we just don't like to prescribe pain
medication. I got you.
So we
because it kind of creates we saw it with the opioid problem. Exactly.
Right. And so we're trying to look at alternative methods that can help people be relieved of their pain. Listen, you got the AMA listening. You said alternative methods. The big pharma didn't like that, Janet. I know, but still prescribing Tylenol.
Right.
And, people that can take ibuprofen.
Yeah.
But looking at ways that people don't have to be on harder medications.
I like that.
Like narcotics. We really try to stay away from that if possible.
Let me ask you this. I'm going to go off a little bit. Maybe we can come back and talk about this because I'm just, I remember taking a class at a school both of you and I attended, and it was Tuskegee, and I remember taking a class called Practice Management, and it was in the veterinary school, and I just kind of remember everything that entailed. But I just want to ask you, have you been out here talking to young doctors or things? Because I just want people to understand the magnitude of how you're operating, not only the multiple locations, which is impressive in itself. That some people never ascribe to that. It's hard enough managing one practice, but the ability to bring people in, all these disciplines, and operate at a very high level, more importantly, give quality service, and then provide needs. Have you spoken over to the medical schools, or have you spoken at conferences about that? I'm sorry, this is just very impressive. Not only, obviously for anybody, but then as a woman doctor, I'm just going to say it. This is just absolutely top notch right here. I'm sorry, I just wanted to tell you that. Have you spoken in front of people about this? They need to be picking your brain.
So I typically go to Indiana University, Northwest. For people who don't know, there is a 4-year medical school sitting in the heart of Gary, right here, right.
You need to be the face of it. You and McGee.
And so yes, I do speak with medical students, and I actually. If you work at a fairly qualified health center, if you have student loans, if you're at a fairly qualified health center for either 2 years or 4 years and you stay, you can get all of your school loans paid back.
Wow.
And so that is the thing that I kind of go with.
So repeat that.
If you go into primary care,
Yes.
which is family medicine,
Yeah.
clinical psychology,
Yeah.
dental hygiene,
Yeah.
dentist, licensed clinical social worker, pediatrician,
Yes.
obstetrician, you can work at a fairly qualified health center and have your school loans paid back.
You need to go after you leave. You need to go over to the career center after you leave here and go tell that CNA, that medical technology group, that stuff, because I'm sure a lot of them would love to hear that. That's amazing.
And so, because primary care is in such high demand
Right.
and high need in the community, you know, you can go and get a GI doctor, gastroenterologist, cardiologist, neurologist.
Exactly. Charlatans. No,
No,
I'm just
but
playing.
it's just the simple fact that those specialties, you know, people are going into those specialties,
Right.
you know, because that's the work that they want to do, but then also there's a greater payout,
Right.
so to
Yeah.
speak, to help pay back those school
Oh, don't
loans.
even get me started, because I talk to you know, I mean, when your boy Roland comes on here, he and I go at it, because I always tell him that the nurse practitioners are coming for you all. I mean, you know, they're out here, and then obviously you throw in artificial intelligence, AI. I mean, medicine is kind of getting fluid right now, but that's why it's very impressive to kind of see where you're going. We're talking with Dr. Janet Seabrook of Community Health Net, and as I said, I can pick her brain all day. She's doing some impressive things, but the reason we're here is to talk about the September 30th event, which is the Breast Cancer Walk that's going to take place at Marquette Park. 9 a.m. is the registration, and the walk officially starts at 10. Talk to me about your affiliation or getting involved in this. How important is this, and what does this bring on as a result of having these walks?
Okay, so thank you so much for bringing this topic to the table. So we've been doing this breast cancer walk for as long as we've been in existence.
Absolutely.
So over 25 years we've been giving this breast cancer walk.
Wait a minute, Janet. You look like you're 12. Don't lie to our audience.
We've been doing it 25 years.
You're making me feel real good this morning. I have not even had coffee yet. So
you don't need coffee when you come here.
Yes, we have. It's been over 25 years.
Wow.
So out at the beautiful shores of Lake Michigan at Marquette. It's a 5K walk, very easy. Like you said, registration at 9, walk starts at 10.
Yeah.
And by 11:30, we're done. It's a pretty, quick pace.
It is.
It doesn't take up your day. It's inexpensive. It's $30.
That's it.
If you get a team of friends, it's $300, and all of the money goes to help defray the cost of mammograms and other services for men and women whose insurance either doesn't cover it or they're uninsured. And we've been doing that and helping people get mammograms and ultrasounds since we've been in existence.
Now, talk to people about that, because you and I have talked about this. As a matter of fact, we talked a little bit about the last time when you called in, but I want people to kind of understand and appreciate about just how much those resources are important to people of all different type of income groups, because I don't think people understand is that when you go through treatment, there's a lot. Sometimes, in particular, depending on your radiation or your chemo, or maybe a combination of both. Sometimes your spouse is still working because you're obviously not working, and then you need transportation because you're unable to drive. Sometimes those little things to kind of get you through, and the support groups and all these things. And so this money is not just like, hey, you were throwing it towards a cure and things like that. As you pointed out, this money goes towards resources that help people. Sometimes I've seen organizations that go out here and buy wigs and things of that. I mean, this stuff is important. So I just really want people to appreciate that.
And so what we do with our funding is specifically for mammograms and ultrasounds. But however, we're tied into some of those organizations that you mentioned. I'm not going to buy a wig if I know that there's organizations out there that will go ahead and do it for you. So it's a way to kind of share the resources.
You just said something very provocative, because I get listen, one of the things that I do, and your friend Chelsea over there will tell you, is that when we have 501c3s over here, one of the things I always I'm a little critical about redundancy. Sometimes there are organizations out here that are doing something, and then here comes another one that pops up, and they're doing really the same thing. What you just said was absolutely one of the most refreshing things, and I didn't even solicit it out of you, so go ahead.
No, and so, I mean, if I know that there's another resource in the community that is doing the wigs, that is transporting or helping defray the cost of radiation or chemo, and I'm going to direct you to those organizations.
Right.
Because, we need to make sure that our resources are, that we collect from people and say that we're doing mammograms and ultrasounds and other things that you can't pay for that will help you get a diagnosis. And I know that there's someone else in the community that is doing those other things.
Yeah.
I'm going to direct you to those organizations because that's what they're receiving their funding to do.
Right, and they probably are doing it. They've been doing it for a minute. They have a little bit of expertise going into that.
And we work very closely with the American Cancer Society, that organization. So I think, and utilizing the American Cancer Society not just for breast cancer but for colon cancer and other as a resource for other diagnoses that we make in the community. We want to make sure that we loop people in.
Absolutely.
There are so many great resources out there in the atmosphere, and you just need to help people make those connections.
Yeah, we're talking with Dr. Janet Seabrook of Community Health Net. Of course, as we were just conversing, we were talking about the breast cancer walk that's going to take place on September 30th over at Marquette Park, beautiful Gary, Indiana. I want to kind of switch gears because this is something that obviously with the First Lady and the President's kind of been alluding to this, and it's a conversation, and I know you know where I'm going with this. Guys like you, Dr. Walker, have always been on the front line since 2020, because I remember, because I was going to work and you all were my resources. But people are concerned about mixed messaging that's coming out about this new COVID variant, the BA2, I believe, 0.56 or something, and about the possibility of new mask mandates. I saw Huntington Beach, they said that they're not. I mean, it's starting, the political stuff is coming up, but I want to talk to you about the medical concerns we should have. I mean, Whoopi Goldberg, for instance, is getting a lot of attention. She was absent from The View for a couple of days because she is at home with COVID again after having the vaccine and then the boosters that accompanied it. What do you tell a community like ours, or the one you serve, that, obviously you have a lot of seniors that are coming to you as well, and people are concerned. They trust your judgment. So what would you tell us about this oncoming wave of COVID-19 that we're being told about?
So I'll start with this. Mask mandates aren't going to work if they're coming from a governmental level.
I like
People
that.
are just going to go back into their corners and just start to put up a fight against it.
Yeah.
And so what we discuss in our clinics, because we're still wearing masks in the office, because we are a medical facility.
Right, I get it.
We have masks available for patients and guests when they check in at the registration desk. But I've asked staff to not have those conversations or arguments with patients who are refusing.
Yes.
Just ask them to take it, put it in their bag person, and they can have that conversation with their healthcare provider when they get to the bag.
Right.
Our physicians and nurse practitioners continue to mask because they know that, they are at risk for COVID with the number of people that they're coming into contact with. So Community Health Net, with our providers, are continuing to wear, that means our doctors and nurse practitioners continue to mask up and see patients. I think it's going to be very difficult coming out of, shutdowns and lockdowns. People are scared and people act out of fear.
Right.
So I think that a lot of that anger actually is a front for being scared of the situation, because I don't know anyone that doesn't know anyone that either had COVID, a severe case, a mild case, or died of COVID.
Right.
So it impacted a lot of people. So my recommendation, and what I'm going to do personally, I was like digging through my bag for my mask because I have a spread out all over my vehicle.
Right.
I wanted to make sure I had one in my purse when I came in, because I want to be able to put it on when I leave.
Yeah.
And so that's my personal choice. I think that people who have medical conditions,
absolutely,
cancer and other immunocompromised diseases, they need to have that talk with their healthcare provider, but they really should consider getting masks. Now, there's going to be a lot of controversy not only with masks, but then with the shot, the shot, yes, because people are just going to refuse. Yeah, because there's, they're going to say, well, I'm going to get COVID anyway.
Or how about, I've always blamed the messaging rather than the science. I'm a believer in science. I'm not a medical doctor or anything like that. Understand pharmacology and things like that. But I appreciate the science. That's why I love having these conversations with you. I sometimes get into debates, but I love talking with Dr. Walker, because I think it's very important that we go out here and really kind of talk without emotions getting involved in this. And I've always blamed the messaging during COVID. I think that, and I understand, I have to appreciate the fact that I've never been a public health official. I've never been the head of a government, that you have this virus coming in that is all over the news. We're hearing about people dying, and your job is to go out here and put information out as rapidly as possible. And that's what our Dr. Fauci and NIH and all those guys had to do. Dr. Burke's even down in Indianapolis, they had to do it, but it was mixed messaging. Hey, kids aren't going to get it. And then we ended up, now we have vaccine requirements for young people. We were told that, only the immunocompromised people and then our elderly should be worrying about, avoiding or wearing masks. And we found out that we're going to expand it to the 40-ish and to the 30-ish. And it just got kind of messed up. And now it's become such a situation that I would assume that, outside of your loyal patients, it's kind of hard to think about convincing people who have not gotten a shot right now or gotten a shot in the past to even think about getting it now.
Oh, yeah. So that's going to be very difficult. If someone hasn't gotten a shot in all of this time, it's highly likely that they're not going to get it.
But how about, the flu? Because one of the things that I think has gotten lost in the shuffle is influenza. And that's still out here as deadly as possible. I remember I used to take my mother to get a flu shot, and after a while, at the beginning, I was kind of skeptical about her doing it. But as she got older, and I really saw that she needed a little level of protection, it was my idea. I was driving over to get to her. So how do you keep the flu and all these, these other things that people need to be cognizant of? How do you keep that out in front and center?
So you've always had a subset of the population that have never taken the flu vaccine either.
Yeah.
And so as we, see more of COVID and questions about variants and viruses, like you said, it was just so much mixed messaging.
Yeah.
And this is the first time as a country, and actually the whole world, being confronted with something at one time so virulent as COVID.
Yeah.
And so I think that it not only it brought to the forefront things that it's like when you're making sausage. Yeah. If you probably saw how sausage was made,
I always say that on the show. You're right.
You wouldn't eat it, but the sausage was being made, as far as
COVID,
in front of everybody.
Yeah.
And they were like, I don't want that.
Exactly.
And that's a simple way of putting it, but it actually is a way to kind of help people understand that this is...
It was a lie.
Science was happening
right in front of
real time,
right
in front of you, and not in the labs.
Yeah.
And in journals and papers and discussions and conferences.
Yeah, it wasn't theory anymore. This is real. And then one of the other things, and I stopped doing it when when I was on the air, because I was on the air during COVID, and the newspapers and all the media outlets, we were leading off our shows with the death count and who got COVID, and I made a point to stop doing that because it was so depressing and it wasn't really telling the story. But you're right, there was just a lot happening at that time, and it was a lot to digest. And so I guess going forward, I mean, what would you tell your clients? It'd be best to talk with your healthcare provider and have that personal conversation.
That's what I have been. Every talk show, every radio, wherever I've been, I've talked to your healthcare provider. Now, if you're someone who typically has gotten the flu vaccine annually, get the flu vaccine, and if you're eligible, get your COVID shot. You have 2 arms. You can get one in each arm and be done with it. But you don't have to. I don't think people who take the flu vaccine are as hard to convince as it is somebody who has never taken the flu vaccine.
Right. I think vaccines have taken a hit for a hot second. Yeah, in particular with adults.
Yes. But with some children, because we had a small subset of the population who didn't vaccinate. Yeah, who
were anti-vax,
Right. And that has seemed to get larger. So what we're going to see as those children get older, infectious diseases that we had conquered are going to start to come back. Now we'll have to deal with that.
Let me ask you this. I know we're pressed for time, but one of the things is you alluded to this kind of when we were talking about alternative medicines. And during COVID, one of the things that I think we also had the opportunity to do, in particular in the Black community, was look at, our dietary habits and just some of because we were absolutely susceptible to getting this more than some of the other demographics. And so does it provide opportunities in medicine to kind of re-examine the way medicine is applied in the Black community specifically? Because, I can't help it but come from my animal background. Everything is pretty much based on diet. And then you can kind of build off that with heredity and all these other problems, environmental and the other things that start to happen. But you got to watch what you put into your body. That kind of starts the process. And so is it time for us to look at, like you're talking about the pharmacies, and I know you work with Curtis, and you and Curtis occasionally get together over at Faith Farms. They're doing their pharmacy as far as the vegetables and things like that. But are these things that you see that we should be kind of championing going forward in our communities?
Oh, most definitely. Community Health Net actually started our own community farm not too far from where Pastor Whitaker is.
Yeah.
And then we're looking at starting another one at our 35th Avenue location as well. We just had some of that land cleared. Hopefully next season we'll be able to do that. But that food is medicine program that Pastor Whitaker is working with. We actually give referrals to our patients. Again, it's another community resource.
Right.
Why are we going to reinvent the wheel?
I like that.
His program has been long-standing for quite a while, so we want to help support that in the community. But the other thing is, I think during the pandemic, you hit on some key points. During the pandemic, I think people, as they were sitting in the house, people started to realize that there were other things that they can do, like going out into the garden.
Yes.
Bringing healthy things into the house because our time in the grocery store
Exercising.
Exercise. So I think that it did start to help people realize that what they were doing to themselves by being sedentary, sitting around the house, not doing a lot prior to the pandemic. And I think it gave people a chance to really do a lot of self-reflection. And to understand that their diseases like hypertension, heart disease, uncontrolled diabetes, pretty much, if it wasn't genetically given to you, like the heart disease, you pretty much were doing those things to yourself.
Absolutely. Stop making me feel bad about myself. We're talking to Dr. Janet Seabrook of Community Health Net. Once again, a wonderful event taking place September 30th over at Marquette Park. It is a breast cancer walk. Registration at 9. The walk itself starts at 10. As Dr. Janet said, you can kind of get it. It's very fun. Sometimes there's competitive little light competition that goes on. But a lot of organizations go. It's well represented. I really have had good times going there. I always, give me the logistics because once again, we could talk for hours. But I want people to know you've got a number of locations, but please give us the hours and give us the locations and the website if possible.
Well, we have one more activity. It's actually
go ahead, then tell us, whatever you want.
It's at Jay's Breakfast Club.
Oh, that's right. I forgot. Sorry, Jocelyn. I got to deal with her tomorrow. Go ahead.
So next Thursday, September 14th, 5 p.m. the doors are going to open. Dinner's at 6. You can go online to Facebook or other social media pages. Use the QR code to register because you do have to register. It's limited seating. And we're just going to have dinner and talk about whatever it is you want to talk about. We're going to find out, what we can do to get you to come back to Community Health Net, what other services we can provide to the community. That the community may be in need of. So we're just really trying to get to know the community a little better and ask them some things and break bread with them.
You're all over the place, Janet. And you know what? I understand because, as I said, when you're out here doing these alternative conversations and stuff like that with me, you're not being invited to the conventions by Big Pharma. So you can't get your beach house like that. You got to go out here and work for it.
You wanted to know the location. So we're at 1021 West 5th Avenue. 3503 Martin Luther King. 3900 Calhoun Street. That is the Calumet New Tech High School.
That is.
And we've added on. We have a brand new waiting room and a consultation room. So we added some square footage during the pandemic. So we're excited about that. 5927 Columbia Avenue in Hammond. We're in Hammond Central High School and Hammond Morton High School.
Oh my goodness.
Miller.
You're over there off of Shelby
Street.
Shelby
Shelby Street. And then No, it's one more. God help me. Oh,
61st.
61st Avenue.
Broadway
Yeah,
in Maryville.
yeah.
So there are 8 locations, soon to be 9.
Oh my goodness.
And probably 10.
I know I'm a little
early
old,
next
but are
year.
you willing to adopt somebody? I'm in an orphan right now.
Oh my goodness.
Yeah, but very good stuff, Janet. Always great to talk to you. And once again, we want to thank you for what you do in all seriousness. Real quick, ETA on West Side, number 10.
Hopefully at the beginning of January. We have to. We're waiting on.
One more.
We're waiting on one thing. I want to know if, because we applied for some funding.
I remember you telling me that.
If we're able to get that funding, then we'll be able to move in really quickly. If not, then we'll have to do some fundraisers. And talk to some people before, because we have the space.
Yeah.
But we need to fix it up.
Look at you. You're like the Oprah Winfrey of like local medicine. All right. Anyway, it's always been fun, Janet. Once again, we appreciate you. You're a very busy woman, obviously, but like I said, a lot of information. We want to make sure people get to these events. Once again, September 14th, that's the first one coming up, Jay's Breakfast Club. Just kind of sit down, have some great food, and ask questions, and just great conversation, breaking bread, talking about medicine. And then, of course, the big thing, the breast cancer walk, September 30th.
Yes.
Absolutely. Thank you. Thank you. There you go. Community Health Net, Dr. Jan Seabrook. Do not turn your dial. Coming up in about a minute or two, we're going to be talking with the Urban League of Northwest Indiana, find out what they're up to. I see one of the surrogates of my friend, Dr. Vanessa Allen